Tim McBride brings well over 2 decades of academic service to rural health services research. He currently serves as Associate Dean for Public Health at the Brown School of Social Work at Washington University. In that role, he has recently developed and instituted a new Masters of Public Health program. Dr. McBride's healthcare research is far-ranging. From his commentary on the Health Security Act in the early 1990s to his current interest in the Affordable Care Act, Dr. McBride has always been a passionate and reasoned voice for rural people and places. His work is widely published in academic and health policy literature. Dr. McBride has provided testimony to Congress, educated legislative staff members, and composed persuasive op-eds for national media, all in support of rural health. In addition to his academic and health services career, Dr. McBride is a devoted husband, father, and an occasional Santa Claus.
I want to thank the National Rural Health Association, especially President Alan Morgan, for this award, the Educational Services Committee. I'm very honored and humbled to receive this award, but I also want to say that I share this award with the many people that I've worked with over the years, most especially in the Rupri family and on the Rural Health Panel, including many past awardee winners, including Becky Slifkin, Mary Wakefield, Wayne Myers, Bob Crittenden, Sidney Watson, and Clint McKinney, who I believe nominated me for this award and is a brilliant health researcher himself. But I'd be remiss if I didn't mention 3 people in particular I've worked with the longest. Chuck Flaherty, who started Rupri and has been a great and loyal friend and colleague over the years, and there is no better friend for rural America. Andy Coburn has been a great colleague and mentor and co-author in many of my projects. But last and certainly not least is Keith Mueller, my most frequent co-author, and as you know, is one of the most brilliant health researchers in the field. Keith is not only that, but he's the most loyal colleague and friend anyone could ask for, and one of the best mentors around. I also want to thank my staff over the years who've helped me on this work, including Leah Kimper, Courtney Andrews, Lisa Pollock, Abby Barker, and Kim Friels. I've been blessed to work with great people. Finally, I want to say that I've always kept in mind the frequent thought that we do our work to improve the lives of the people, the rural beneficiary, most especially the vulnerable and the poor. I always try to keep that focus in mind, the variation of the biblical thought, how does it affect the least of these? I was born in a city, in an urban area, but all I know about rural America I've learned from my rural health colleagues, and most especially my wife, soulmate, and best friend, Shirley Porterfield, who grew up in the most rural of areas of California, far northeast corner, Lake City. When I visit there and I meet her wonderful mother, Elaine Lee, and the people around there, I learn what health and social issues really mean for rural America. I dedicate this award to Shirley with love and for this and all more. Thank you very much.